our usual crew, but we also have a couple of new guests that we'd like to introduce you to, or one new guest, to provide some new information that we wanted to cover today. Supervisor Fletcher is here to provide an update on the charts and graphs that paint a picture of our progress against this pandemic. Nick Mascione, who's the director of our Health and Human Services Agency, is our new guest today, and he's here to talk about the lab testing task force and the work that they're doing. And then Dr. Wooten is here to give us the medical update, and then we will have Dr. Nick Infantidis will discuss the importance of facial coverings, and then we'll go to the question and answers. As we all know, San Diego is fortunate to have a part of the border mega region with our neighbors to the south. Our international border is a key cog in our regional economy, offering a lifeline for the flow of goods, material, and a vibrant workforce that contributes greatly to our local economy and industries. When Baja succeeds, we succeed. But right now, Baja California is suffering the ravages of this pandemic just as we are. We are aware of what's going on down there, and we are working to help and provide assistance where we can. Our medical leaders are engaged in regular conversations with their counterparts in Baja California to monitor their rise in cases, and the San Diego Regional Border United Command is continuing to provide information on the southern border. In addition, we are talking to the California Health and Human Services Agency on the situation in Baja California. Meanwhile, we have contacted the White House to ask for assistance on this international matter. Last week, Supervisor Kristen Gaspar sent a letter to the Vice President asking for federal assistance on this matter, including providing mutual aid to Mexico, instituting temperature checks at the border that would allow us to better monitor and address border crossings. That letter had an impact, as the Department of Homeland Security is working to address the requests and bring them to the attention of the Vice President. I want to thank Supervisor Gaspar for her leadership on this front. It's very clear that her letter opened up the lines of communication between the White House and the county on this matter, and we hope to see some positive results as a result of that. As we've said before, this virus does not respect borders or boundaries. It is truly a global pandemic, and so we will continue to monitor the situation in Mexico and work with our counterparts there to assist them while at the same time protecting our region. Now it's my pleasure to introduce Supervisor Fletcher.
Thank you and good afternoon. During this time when our medical professionals and essential workers are leading our community through this public health crisis, I want to take a moment to acknowledge that today is Workers' Memorial Day. Today is a day we remember and recognize all workers who have been injured, disabled, become sick, or killed while carrying out the duties of their job. We've seen stories from frontline healthcare workers who not only contracted but sadly died from coronavirus. And today we want to thank every worker, both healthcare and essential workers, for everything you're doing during this global pandemic to protect us, to provide the essential services, and keep our communities moving forward. And a special mention to those workers and their families who have become ill or died as a result of their work. Today, the governor outlined his 6 criteria needed forward to move forward, and in particular, he talked a little bit about the stages of opening, with us currently being in step 1. Our ability to move to step 2, which provides additional opportunities for businesses, he said, is weeks, not months away, but it is based on not only our ability to continue to see flattening in terms of our impact on our healthcare system, but also the ability to have in place a robust system for testing, tracing, and treatment. We are very focused on meeting this challenge in San Diego County. Our ability to provide robust testing, the proper contact tracing, and the treatment and isolation capacity will be a critical one once we start to look into open up businesses, schools, childcare, and other types of opportunities. Without those capabilities in place, the virus can quickly take hold and we could see widespread outbreaks. If we are able to quickly test everyone who is symptomatic or is appropriate to be tested, quickly find others that they may have been in contact with, isolate and treat those positive individuals, it will go a long way towards putting us in a new posture of kind of this new normal where we are able to contain coronavirus as we move forward. In a moment, I will introduce Nick Mascione, our Director of Health and Human Services, who's going to be leading our testing, tracing, and treatment, what we call T3 effort. He will provide a report out on our testing task force, which met last night, along with some updates around our efforts around all three of those, because the three of these things, the testing, the tracing, and the treatment, all go together in one thing that is vitally important for us moving into future phases. Another item mentioned in the state briefing was our ability to adapt, our ability to take steps to minimize risk. A part of this is face coverings. Wearing a face covering during the coronavirus pandemic is a preventive measure that we can all take to protect ourselves, but also we take to protect others. Wearing a face cover is similar to putting on sunscreen when you go out in the sun. When you put on sunscreen, the sun does not go away. The harmful rays do not go away, but it many times, if done properly, will stop or limit their ability to burn your skin. When you wear a face covering, coronavirus doesn't magically disappear, it doesn't magically go away, but it similarly provides a level of protection, both to yourself, but in this case, others who may be around you. We understand it may be inconvenient. We certainly understand it will take some getting used to, but it is an important part of our COVID response, and it is an important part of us changing our daily activities and changing our posture that will begin to facilitate the easing, and as we facilitate that easing, hopefully contain the spread, which will allow us, as we begin to gradually turn that dial, to continue to see positive progress. We want to continue to move forward. We don't want to take steps forward that require us to then move backwards, and a part of that is us adapting to the new realities of what we will face and confront until such time as we have a vaccine or widespread therapeutic treatment, or perhaps both. Dr. Nick Infantidis is here today, and he is going to share some of the science, some of the data, some of the medical expertise on why face coverings are a piece of the broader effort that we do as we move forward to. According to one report, as of April 22nd, 51 countries are now requiring face coverings when in public, and we suspect this number will grow. In the early days of our response, we required face coverings for employees at 7 essential businesses who were interacting with the public, and after some additional adjustment, it seemed to have worked out well. We also had a strong recommendation that the public wear them when they go out, and now we have taken the final step here in terms of requiring them effective Friday. Again, having a face covering helps to slow the spread of the virus. It helps to prevent you from being in contagion with other folks if you may be positive. And it does not replace physical distancing. It does not replace washing your hands. It does not replace the other guidance that we've given, but it is a strong additive to those. And as we begin to contemplate loosening some of the restrictions on our public health orders, we have to also change our mindset. We talked yesterday about the need to be more aware and have more commitment to how we go about daily life. And given we will be existing in a place where the threat from coronavirus remains there until we have a vaccine or widespread treatments, we're going to have to modify a little bit each of our behaviors in an effort to better contain the spread. And so we appreciate Dr. Nick being here to share with us some of the medical perspective and science behind why this recommendation is seen as so important. A quick update on the homeless. To update, out of the total cases county-wide, irrespective of the convention center, we are currently standing at 24 of our total cases throughout San Diego County have tested positive. As it relates to the convention center, it is still just 2 positive cases there. Yesterday, 104 tests were performed. We do not yet have the results of those, but total tests administered to date is 767. This includes 530 residents, 237 staff. Out of this, we have 2 positives, 644 negatives, 17 that were indeterminate and need to be retested, and 104 which are pending results. Now I'm going to get into our daily report on our metrics and charts. You will see today we are reporting 173 new positive cases, a significant jump in testing from the day before, 2,545 total tests performed. This puts us at a 7% rate of positive versus total testing which is much better than yesterday. Again, the day-to-day results are less important than the broader trend line. Here on the chart, you see in orange the daily positives. In blue, you see the total testing, and that purple line represents the cumulative or 14-day rolling average that we see, and this is a number that we would like to see downward trend. Second, we will look at our hospital capacity system. You saw in the governor's briefing today, they talked significantly about hospitalizations and ICUs over time and the desire to see that flat. Here we have reflected COVID-related patients. These are both known COVID and suspected COVID in our hospital system in real time in orange. In blue, you can see the total beds in use. And then again, to repeat what we talked about yesterday, the dotted purple line is current bed capacity. The green line is licensed bed capacity. Current bed capacity is a better number to use because it reflects actual available beds that are in our regional healthcare system and our staff. This is not including federal assets and federal resources. Final chart here today reflects our doubling rates, which you can see the doubling rates for positives at 18. Again, this is a 5-day average, rolling average that takes into account exponential growth. Our estimated number of recoveries, our hospitalizations there, you can see the doubling rate at 28 days. ICUs, doubling rate at 35, and then a few additional deaths today that Dr. Wooten will cover in her report. I'd now like to turn it over to Nick Mascione, our Director of Health and Human Services, who is leading our efforts around T3 testing, tracing, and treatment, to give you an update on the testing task force, testing in general, but also to reinforce the point it is not just testing, it is all three of those components that have to go together to prepare us to move into the future. Thank you.
Thank you, Supervisor Fletcher, and good afternoon, everyone. As Supervisor Fletcher said, I'm here to talk about our T3 strategy: test, trace, and treat. As COVID-19 rolled through our community, the County of San Diego was actually a very early leader in all three categories. That's a testament to the county's medical leadership, with Dr. Wooten at the top, and including Dr. McDonald, Dr. Neck, our public health nurses, all of our hospitals, our clinics, and many community partners. Our public health staff stuck with all of our priority populations, our most vulnerable, including achieving strong results with the capacity and the supply chain challenges that all of our labs and agencies have faced. In the last several weeks, more lab equipment has started becoming available, including new equipment in our own county public health lab. More supplies have also become available. And with Dr. Wooten's actions last week with the release of her KHAN, the definition of prioritized testing has expanded. Now, we still have roadblocks in achieving the nearly 5,200 diagnostic tests that we need to get to daily. I heard about them firsthand yesterday during a meeting with over 60 medical lab professionals from our hospitals, our clinics, and commercial labs. This was the first meeting of the laboratory task force, and they included challenges as items including reagents and swabs and couriers. The good news is none of them are insurmountable, and we're committed to working together and resolving all these barriers as fast as possible to achieve our testing goal. And this includes quickly adding more testing sites to make them more accessible to the public. One example is the start of testing patients and staff at skilled nursing facilities. We actually tested one facility last week. We have 5 more scheduled. Another example was yesterday's addition of 2 new drive-up testing sites in Escondido and Chula Vista. Both sites are the beginning of our efforts to expand more testing at these 2 sites, but as well as developing new drive-up locations throughout the county. Now for tracing, we continue to expand our team of contact tracers. The number of tracers has surpassed 100, and 20 this week are being added. These are our disease detectives, and they're a critical component of our T3 strategy, and we have hundreds more on the way. For treatment, many of you are very aware of what's happening and that we have contracted our public health hotels, and we have stood up reserve capacity of our new 300-bed dorm at UC San Diego, and added 202 beds at Palomar Health in Escondido. These remain as our initial steps, and in the coming days and weeks, we'll be accelerating all 3 components of our T3 strategy. Next will be an update by a public health officer, Dr. Wilma Wooten.
Thank you, Director Mattione, and welcome and good afternoon, everyone. Regarding the global, national, and state statistics, the numbers that we will share with you today are based on data from Johns Hopkins dashboard obtained around noon today. Globally, there are almost 3.1 million positive cases, including almost 215,500 deaths. Nationwide, over 1,005,000 positive cases have been reported, and this includes 57,800 deaths. For the state of California, 45,200 positive cases have been reported, and this includes 1,788 deaths. Today, for this county of San Diego, we are reporting 3,314 cases, which is 173 more cases than reported yesterday, as well as 118 deaths, which includes 5 more deaths than reported yesterday. Of the total number of cases, the age range still remains the same, 3 months of age up to 100 years of age. We have the same percentage of individuals that are 20 to 49 years of age, and this is approximately 51%, or 1,703 individuals. Our female population represents 49% of the total number, and the males represent 51%. And now only 5 individuals have no gender identified. 733, or 22% of cases, have been hospitalized, and 238, or 7% of the total, have been admitted to the ICU. This number is 32% of the total number of those hospitalized. Lastly, of the 118 deaths reported, these represent 4% of the total number of cases. Of the 5 additional deaths, there are 2 females, one in their mid-50s and one in their mid-80s. There are also 3 males, one in their early to mid-70s and 2 in their late 80s. The 5 additional deaths did all have underlying medical conditions. Also, of the 118 deaths, 45% were female, 55% were male. And you can also find the race and ethnicity for those that have died. We have data for 96%, or 113 of the total number of deaths. And this includes 60 or 53% white, 38 or 34% Latino or Hispanic, 9 or 8% Asian, 3 or 3% Black or African American, 1 each for Native Americans, Pacific Islanders, and individual of multiple races. 5 of the 118 deaths had unknown race and ethnicity. Once again, our sincerest sympathies indeed go out to the families and friends of those individuals that were announced today who have died. As a reminder, all of our demographic information can be found on our coronavirus-sd.com website. Regarding outbreaks in congregate and community settings today, we are reporting a cumulative total of 42 confirmed active outbreaks. Of these active outbreaks, 28 are in congregate facilities. This includes 1 new outbreak since yesterday, representing 664 cases and 57 deaths, as well as 14 outbreaks in community setting locations, representing 115 cases and 4 deaths. Again, I would like to commend the public for staying the course, and this only helps to further decrease the spread of COVID-19. Everyone is making a tremendous effort and sacrifice, so I really want to thank you. We are optimistic that the 5 metrics that we reviewed yesterday, we are continuing to monitor those and have the expectation that these metrics will be trending in the right direction. But this can only happen with your help. So we will review these metrics again tomorrow. Now please welcome Dr. Nick Ifantides to the podium.
Thank you so much, Dr. Wooten, and good afternoon, everybody. As has already been mentioned, this Friday we are going to be providing additional updates to our directives, and an important part of that is going to be facial coverings. So I'd like to put that in context and discuss things a little bit from a both scientific perspective, and then I have a couple comments at the end that I'd like to share from the heart. As we talk about facial coverings, it is very important to be reminded of the reality that because this is a brand new novel virus that has never previously infected humanity, we have no pre-existent immunity, there is no vaccine that is currently available, and there are no currently proven medication treatments, though there is a tremendous amount of research, and with some of the interventions like plasma transmissions, there is some promising potential. Our best hope remains non-pharmaceutical interventions, the ones that we have been talking about here daily. Social distancing is the obvious one, but I would submit that face coverings fit into that category. I also want to remind folks that as the science on a new virus is evolving so rapidly, that there is now no doubt that COVID transmission of the virus can occur before any symptoms are present, and it can occur from those who are infected who will never have any symptoms whatsoever, despite experiencing the infection. And when we talk about transmission, obviously we've talked about the respiratory component, but there are different sizes, and I'm not going to go into it in too much detail, but folks, there is now quantification that there is transmission by larger particles that come from our lungs and upper respiratory system. Those would be called droplets, but there are also smaller, even more microscopic particles that can be generated. Those are known as aerosolized particles. And then a reminder, which is part of the reason that we don't want people coughing in their hands and then touching things, is when you cough in your hand and then you touch a doorknob, that turns a transmission capacity into a surface-based transmission risk as well. What I'd like to share today is the fact that there is now some early emerging evidence that even cloth masks, like the homemade one that I am wearing, and because I do not touch my face in public, I will not remove it while I am speaking, even homemade cloth masks like the one that I'm wearing have now some growing evidence that they may not capture the aerosolized particles, but they are effective in potentially decreasing the transmission of the larger droplets. There is some preliminary data and some early evidence I'm going to show you in just a moment that when we have near universal, even non-medical masks being used in public, and when that strategy is combined with the other public health measures that we talk about here daily, there is some growing evidence that it can reduce the rate of transmission. And with that, I'd like to call up a couple charts that we have available. And again, these are preliminary, but at this point, something is better than nothing. This is a small volunteer study that was done in just over 21 individuals that voluntarily did coughing. And there was a comparison in terms of particle transmission in those in red, at the time not wearing any mask, those in the light blue wearing the kind of mask that I have on right now, a homemade cloth mask, and finally, the surgical grade mask. And you can see along the bottom are different particle sizes that even the homemade masks for various particle sizes can make a huge difference. The next chart, which is quite glow-in-the-dark, neon, and fancy, and it's a little bit complicated because it looks at things from 3 different dimensions, really looks at data in terms of, on the left axis, the percentage of us that will hopefully be adhering to what we're going to be recommending. Along the bottom axis, the efficacy of the mask, which is going to be variable, whether or not it's an N95, a surgical mask. What we're talking about today are cloth, non-medical, non-surgical masks. And along the side is something called the reproductive number. The goal that we have with this virus is to get the RO, the rho, to be less than 1. Might be a little counterintuitive. The goal is to get things in the top right-hand corner, i.e. the blue zone. And what this is showing preliminarily is that when you adhere publicly to wearing the mask, even if it's a mask that might not be as efficacious and official as a surgical mask, there is some evidence of decreasing the rate of transmission and thereby facilitating the likelihood that we will get to the other side of this as soon as possible. Having shared a couple things from the mind, I'd like to now close with just, if I may, a couple thoughts from the heart. You know, one thing that I have said to my family and my close friends, that we actually have more than one pandemic happening right now. I strongly feel that we also have a pandemic of opinions. And I understand that we have so many opinions, folks, and that those opinions are occurring in the absence and in the vacuum because all of this is so new. And there is a hunger for objectivity. But many of those opinions are sometimes potentially counterproductive. And I just want to call out, especially, not anybody individually, but especially when some of those very polarized opinions are coming from fellow medical colleagues of mine who are looking at things through a thin lens. The other thing I want to say, the second thing, is that, you know, I look at wearing a face covering as being a relatively benign thing. There are going to be exceptions for people who have medical issues and so forth. But folks, this is not that big of a deal. I'm standing in front of you doing a press conference without even removing it. My old Greek uncle once said, Hippocrates, it's attributed to him, first do no harm. There is no harm in wearing a mask. So why don't we just do it? And then lastly, from the heart, to me, wearing a facial covering really isn't as much about protecting yourself as much as it is about protecting others. What we are talking about here, by decreasing the particle size transmission when we're singing and coughing and sneezing and talking and yelling or whatever it is that we do in public, consider it and look at it. Even though it may not be 100% scientifically proven, the fact that it even has the potential, consider it as an act of love. And just as a word picture, I'm going to go there. If all I had was available, and I knew that it would help you, in love, I would wear a dirty sock in order to prevent the transmission of this virus. And so come on, people. Let's do this together. We are San Diego. Thank you.
Thank you, Dr. Nick. Let's go directly to the questions again as we call you up. If you are not identified by name and outlet in the introduction, please do so before you ask your question.
Jonathan Logan with the Union Tribune. Please state your question.
Hi, question for Dr. Wooten regarding the 2 new testing sites that opened up in Escondido as well as in Chula Vista, the 2 sites that opened up yesterday. So it seems like I stopped by the Escondido site. There weren't too many people there. We had a colleague who stopped by in Chula Vista as well. how quickly do you anticipate getting more people at those sites? How many people can each site handle? And is the plan to do contact tracing on every person who comes up positive? Has there been any discussion of adding more sites as needed? And for folks who don't have a car and so can't go to these drive-through testing sites, what options are you looking into for them as well?
Okay, Dr. Wooten's here, and she'll respond.
So thank you for the question. At the two sites that we have, I'll just give you the numbers. At the south location, we had a total capacity yesterday for 24, and we tested 22. At the north, we had a total capacity of 20, and we tested 15. At our stadium, we have a total capacity for 30, and we tested 22. So yesterday, in those three sites, we tested 59 out of a total capacity of 74. And keep in mind, sometimes people schedule and then don't show up, and that did occur in a couple of those cases. So as we reach capacity for the one line that we have, we will add additional drive-through lines, and we do plan to increase our drive-through line at the stadium on Friday. So those are the numbers for our drive-through.
Okay. And for folks who don't have cars, what are you looking into for them?
Well, for other individuals, we are asking them to work through their primary care providers and be tested through the various sites that their system has across the county. People are using, and also in terms of the priorities, some of the priorities in the 1, 2, and 3, and 4 tier levels, individuals can be symptomatic, and we don't want people traveling on transit symptomatic. That's why we have the drive-through process. But we also are focusing on testing those individuals that are asymptomatic in certain priority groups. So just wanted to let you know, and that was, again, reviewed in our priority testing actually last week on Friday.
Okay, let's go to the next question.
Okay. Shalina Shatlani with KPBS, please state your question.
Hey there, I have two questions here. The first is the county planning on releasing some guidelines for when we are supposed to be wearing the masks? I know that we've heard some questions about, people who want to go outside for a run and finding it difficult to wear the mask on. So, in what situation, are there exceptions in wearing the mask in public at any time? And, if you aren't planning on releasing an outline now, maybe you can sort of go through some of that now.
Okay, Dr. Wooten's going to respond.
Thank you for the opportunity to clarify any misunderstandings about the use of the mask. Our intention is to make that announcement on Thursday to begin on Friday with mandatory use of masks. The phrase that we use when you leave your place, cover your face. And I think that Dr. Ifantidis has just done an eloquent job of explaining why we are recommending the use of masks. And we want people, when they leave their homes, to have their mask with them around their neck, so that when they come within 6 feet of individuals, they pull it up, whether they're running, whether they're walking, or strolling with their child, or walking with their families. We want people to use their masks when they come within 6 feet of others, if they are not a household unit. Thank you.
Thanks. My other question is about mass testing and also the role of blood tests as well. So I've seen, in some other states, in some other cities, they've decided to just do thousands of tests in one weekend. Is that, I know you're saying that you want to increase testing capacity. What's the role of doing mass testing that's maybe not based on a prioritization of certain individuals? Why aren't we doing that? And also, in order to really have a sense of how much this is spreading, are we also planning on including blood tests in this increase in testing?
The push for testing that we are currently in the T3 strategy that our agency director described is focused on diagnostic testing, and that is the PCR test. So because we want to identify those individuals that are currently infected. So the priority list, actually, if you look at the priority list, it pretty much includes everyone. I would encourage you to review that document because it does include everyone. Even on the federal side, in Tier 3, it talks about those individuals that might have mild symptoms, but we want to prioritize our healthcare workers as well as our first responders. And then we want to prioritize those individuals that have underlying medical conditions. Just looking at those three categories alone, that would be a large number of individuals being tested. So that's what we are encouraging our healthcare systems, is to look at testing of their staff, whether symptomatic or asymptomatic, to look at their population of patients that have underlying medical conditions that are over 65 years of age. And then we, as in the county government, is looking at testing long-term care facilities. And we are also working with hospitals to start doing that as well. So there's a lot of opportunity, and we just want to implement the strategy that we've identified in working with the public health laboratory directors across the county. And I also might want to add that if you look at or compare the number of tests that have been performed in San Diego County, Santa Clara County, Orange and Riverside, San Diego County has conducted the most number of tests. And that's not saying we can't or need to do more, but we have conducted the most number of tests compared to those counties. And our strategy and plan is to reach the 5,100 tests daily that has been identified. And we are doing that with the help of our local partners. Thank you.
Okay, let's go to the next question.
Brandon Lewis with CBS 8, please state your question.
Hi. So we've noticed that many of the new cases are continuing to come into some of the South Bay communities, and many of these zip codes are also seeing high levels of employment. So wondering if someone from County Health perhaps can talk about, through its tracing program, if they're finding access to insurance, which is usually tied to jobs, is causing people to delay care, and also if you could speak perhaps to any socioeconomic factors that we might be seeing playing out.
Okay, Dr. Wooten's going to respond.
Well, I'll start with the last part of your question first. If you look at on our county's website, and it shows all of our tests broken down by race and ethnicity, the largest number of our cases are in whites, followed by Latinos, followed by Asian Americans. Actually, we also have rates data on our website as well. So the information that we have for all of our tests and the population demographics is provided on the website. And it actually, we've just started seeing African Americans, particularly in those individuals that have succumbed to deaths. But there are now individuals in all of the various race and ethnic groups. But again, whites, Latinos, and Asians are the top three. And also, you asked about the southern part of the county. Aside from just the City of San Diego, Chula Vista is the second largest city in the county of San Diego, and it is densely populated. So I wouldn't read too much in the fact that we have a large number of cases in that part of our county. Thank you.
Could you, Dr. Wooten, also address access to insurance if people are losing their jobs, whether that's maybe impacting or delaying care, please?
We haven't done or looked at insurance status for individuals. That really probably would take some additional research and investigation. It's something we can look at, but nothing that I'm prepared to share with you today. And our agency director would like to take the mic.
Thank you, Dr. Wooten. That's a very important question, and very important that for us at the Health and Human Service Agency, we maintain our capability of helping people who may have lost a job and need some assistance, both to health insurance or food assistance. And so for us, health insurance here in California is Medi-Cal. And so what we encourage people to do is just dial 211, and that starts the process and links folks into our system where we can help them access to health insurance. So very important, as folks are losing jobs and need that help, that we have that safety net. Also, as people are calling in 211, be it for food and others, we are also talking about the COVID testing. Importance if they have any of the issues or symptoms that Dr. Wooten talked about in the categories, that we tell them where they can go get testing, and if they do not have a doctor, how the 211 through our nurse triage line can assist them and get that testing.
Okay, let's go to the next question.
Alexis Rivas with NBC7, please state your question.
Yep, this is Alexis with NBC7. So yesterday, several coastal mayors told us that the announcement last Friday to allow limited access to the beach caught them off guard. This morning, a number of North County mayors joined County Supervisor Jim Desmond to call to reopen restaurants for dine-in eating and hair salons and big box retailers by Friday. Why does there appear to be a disconnect between the cities and the county when it comes to when to reopen?
I'm going to ask Supervisor Fletcher to respond to that.
Thank you. I think yesterday we covered pretty sufficiently the process that we went through as it related to the coastal cities. We had been communicated with that there was unanimous agreement and that they made a recommendation and that they would be ready to implement when we lifted. If some individual cities were not on board with that, we did not hear any otherwise, and we can only operate with the information and facts that were given. But it is entirely appropriate as it relates to the coast that they can open their beaches at whatever time that they want. We simply lifted the restrictions on entering the water, and we made clear when we did so that individual cities could make the determination on timing, and they could be more restrictive, not less restrictive, as they see fit, and we think that's entirely appropriate. As it relates to the desire to open, I think everyone has a desire to open. I don't think that there's any one who doesn't want to open things. The important thing is that it has to be driven, again, by the facts and the science and the data, and particularly when it comes to businesses, that is a determination that's being driven by the state. That is a determination, as the governor just outlined today. The state of California has defined what is essential and what is non-essential as it relates to business. They've also outlined that they will be determining as a state when we move into additional phases. And so we will continue to monitor that. We will continue to ask folks to remain patient with us. The biggest mistake that we could make as a region would be to move too fast and too swiftly, see a tremendous outbreak and throw away the weeks and weeks of tremendous sacrifice that has been made. I think we all want to move forward, and it's important as we do that we do it gradually, we do it appropriately, we make sure that we have the testing, the tracing, the treatment in place. We make sure that we have all of the things that are needed around PPE for our medical and healthcare communities. And then as we begin to do that we do that in a thorough way and a thoughtful way. So I think it is human nature and natural that some folks are eager to get going. We certainly understand that. But as a county, we have to continue to assess what is in the best interest of the entire county, along with, as it relates to businesses, seek additional guidance and approval from the state of California.
Okay, we'll go to our last phone call.
Will Huntsberry with Voice of San Diego, please state your question.
Hi there. Yeah, this is Will Hunsberry with Voice of San Diego, and you guys have talked about these 5 critical criteria and data points for reopening on a few different occasions. You didn't mention them much today, but you said that we've met 3 out of 5 of them. One we haven't met yet is testing, and the other one is people with COVID symptoms coming to the ER. We need to see a decline in that for 14 days. You guys have shared that data before. I've asked your communications staff to share that data with me yesterday and today, and I haven't gotten it yet. So you're kind of leaving the community in the dark on one of these critical criteria. Can you give us some kind of update on where we're at in that? Are we declining? Are we getting close to 14 days? And can you share that data again?
Okay, Dr. Wooten's going to respond.
Well, we shared that data on Friday, and then I reviewed it again yesterday. And if you noticed during my presentation today, I said I will review all 5 metrics again yesterday. The data doesn't change that much from day to day. So from Friday to Wednesday, we will see a significant, we hope to see a significant change. So we will be sharing that information on tomorrow. Again, it is influenza-like illnesses, it is COVID-like illnesses, or COVID syndromic illnesses, and actually fever and cough are shared by both ILI and COVID. And as well as the percentage of positive tests to overall number of tests, then hospitalizations, and then the last is testing. And for the last 3 days that we've provided briefings here, we've talked a lot about testing because that's very important as it relates to contact tracing as well as isolation or treatment. So we will have an update on these numbers or metrics on tomorrow. Thank you.
Dr. Wooten, I have a question from, oh, go ahead. Go ahead.
Yes, Will, go ahead.
Thank you so much. So I was just trying to, I asked you about this yesterday. I'm sorry for asking it again, but I just am trying to still get a little clarity. You and Dr. McDonald, Dr. Wooten, have mentioned for a couple of weeks now that the county has the capacity to do 1,000 tests a day, but wasn't hitting that mark. A lot of people haven't been hitting their marks for a variety of reasons. I get that. Then the Panther system came online on Friday. My understanding is that added 1,000 additional tests to the capacity, and so that would be 2,000 together. Is that right?
No, I'm sorry, Will, but that's not correct. When we first presented to our Board of Supervisors, we said that our county government public health laboratory had the capacity for 310, and that was utilizing the CDC platform as well as the Abbott M2000 platform. We kept saying that we would soon be getting the Hologic, but we were waiting on the instrument. At our Board of Supervisors meeting last Tuesday, I did say that we have the current capacity for 1,000 plus, and that did include, that did include the new Hologic, but when you get the instrument, you have to validate it. And through our validation process, we were ready to stand that platform up last Friday. So again, we are at 1,000 plus.
Thank you, Dr. Wooten.
You're certainly welcome.
Okay, Dr. Wooten, I have a question from Paul Sisson. Does the county have any way of measuring how many of those with minor symptoms are still not being tested? And if yes, how many are not getting tested under the new KHAN guidance?
So we don't know how many people are out there. The research shows that 80% of all individuals that are infected have mild to moderate symptoms, and early on we were telling those individuals to stay at home because we did not want them to go into the healthcare, our providers' offices, and potentially infect other patients and even providers. Now we are expanding that, and even with the federal priorities, that last priority area is devoted or specifies to treat individuals with mild symptoms if they're in a high priority area. So if you look at the priority testing categories now, pretty much everybody could be included in testing. And so we are looking at the federal, the state, and we created our own county priorities, and we are asking through our laboratory testing task force, we are asking each of the hospitals and community clinics to identify what is going to be their focus area based on these priorities from the federal and state government.
And Dr. Wooten, I have a question from John with Science. It's about contact tracing. Do you or can you estimate how many your team can contact per day at a maximum?
Well, we know that for each case, that generates about, on average, 3 contacts. So we have, are building basically a strategy based on the number of tests that need to be performed over the next several days to reach the 5,168. We're generating, developing the math so we can identify, and we will need about 400 additional staff for contact tracing to accommodate all of the testing that we are doing, assuming that we will have a 6 to 7% positivity rate out of all of the testing that we are doing, which our goal is to achieve 5,100 a day.
And he asked, do you anticipate contact tracing demands exceeding capability, and does San Diego need federal government support that has been discussed with FEMA or other agencies?
We have a lot of county staff that are non-essential, and we are transferring them from being non-essential to essential. And there are other strategies that we are looking at, utilizing external county staffing strategies, whether it is through contracts or temporary staff. And then we are also looking at other strategies, such as other partners that we've identified. So we are confident that we will achieve the number of individuals or that we will need to do the contact tracing for the positive cases and their contacts.
This next question deals with the homeless at the convention center, and Supervisor Fletcher will respond.
Yes, this one's from Lisa Halverstadt, wondering if there have been any COVID-19 deaths in the homeless community.
No.
All right. Thank you, Supervisor Fletcher. This next question is from Bridget Naso, and it's about our Navy ship.
Okay, Dr. McDonald's going to respond.
Thank you. For Bridget from NBC7, what can you say about how San Diego County is assisting the Navy with support for sailors from USS Kidd who are being quarantined off-site, if indeed the county is providing any assistance?
Well, thanks for that question, because it gives me a great chance to talk about the integral and integrated approach that we have with our military colleagues in the county. They have their own preventive medicine services that do much of the work, especially on the active duty side and anything that's physically on their bases within the county. So this particular ship that's coming in is actually home ported in another location. And the Navy has kept us apprised of what they're doing. It turns out that they don't need any direct support from the county. They're actually giving quite robust support to the sailors on that particular ship, and including medical support and social service support. Because a small number of those individuals are being housed off the base, we were kept apprised of that, but really there was no need for us to supply any support to the Navy because they were actually able to do that on their own. It's worth pointing out that the Navy and the Marines have their own robust testing capabilities at the Navy Health Research Center. They do report their positive results to us, and the results from this ship, because this ship is not home ported here, will not be reflected in any statistics that we present here at this forum. The care that will be given, of course, will be within the Navy system. It's also worth pointing out that we do have two naval hospitals, including the largest one in the entire system here in San Diego. The leadership from those hospitals actually participate with us in all of our meetings having to do with the collective response for this crisis, and they've been great partners on the medical side, and of course very strong partners on the preventive medicine side when we have cases that we mutually investigate together. So say an individual who works on the base but that lives off base, we do close contact investigations together with our colleagues in the Navy, and that's actually gone very well.
Dr. McDonald.
This next question deals with golf courses and what may be in store for them, and Dr. Wooten's going to respond.
Yes, this question is from Mark Ziegler with the Union Tribune. Two items. In the county's guidelines for golf courses, the staff must take temperatures of guests when they arrive at the facility, and no individual instruction is allowed. Why is it necessary to take temperatures for outdoor recreation, and why is instruction not allowed when instructors can sit 6, 10, 15 feet from a golfer at the driving range and give a lesson verbally without physical interaction?
Well, thank you for that question. It's complex components there, and I'll try to break each one down one by one. So if we treated the golf courses as a business, they would be closed. So we have chosen to treat the golf courses as an activity, but in this particular case, it is not family units, it is individuals that may not be related, and we have no idea if they are infected or not. So that is number one, why we are recommending the temperature checks, and this is to help identify anyone who's sick, so that if they are sick, they do not expose others, including the people that they're playing with, and any individuals or employees at the golf course. So that's the rationale why we are recommending temperature checks, so that we can ensure that there is that COVID-19 is not spread to others. That's the primary reason.
All right, thank you. And then I do have a follow-up question about taking temperatures. Wondering if at the supermarket entrances, why hasn't this been required or even recommended, given it is a standard public health measure at some of the very hard-hit Asian countries?
Well, unlike the golf courses where people could get relatively close to each other just by virtue of playing, but at the grocery stores, if people are not family units, and I go to the grocery store quite often myself, people are staying that 6 feet away. So it's not necessary to take temperatures as they come in. We are now, or will be, requiring the masks, so that will be an element of protection.
All right, thank you, Dr. Wooten.
One more? Okay.
Okay, I think we have one final question dealing with the border.
Yes, let me pull that one up here. Okay, I'm sorry. Could you, this is from Aaron Leithleaf with Politico. Could you ask Supervisor Cox for more details on DHS's response to the county regarding help on the border? What did they say regarding the county's request for temperature checks at the border and for a temporary hospital there?
Okay, well, again, Supervisor Gaspar did a great job last week in sending this letter to the Vice President. Obviously, it was referred to somebody at Department of Homeland Security. And the representative from Homeland Security has been in contact with Dr. McDonald just to acknowledge that the letter has been received, and they are looking at what they might be able to implement to assist us in regards to the border situation. I do know that we over the last couple of days. I've had a couple of transports, ambulance transports from the border to hospitals in South County, but it's a pretty minuscule number in comparison with the overall cases we're dealing with in the San Diego region. So I hope maybe later this week we'll have something more definitive from the Department of Homeland Security, but at this point, that's the best I can give you right now. So that concludes our calls for today. Thank you all for participating. And then before we close, I just want to go over once again the whole issue of facial coverings, because that seems to be creating some confusion. And again, we're going to be implementing mandatory facial coverings starting on Friday. And I just wanted to, make sure everybody had an understanding of what that facial order means. Over the last several weeks, many of you, many of us have gotten used to wearing bandanas or scarves or cloth masks. So this new order is simply an extension, an enhancement, if you will, of what we've been advocating and preaching over these last couple of weeks. We are directing that when you go outside, you take your covering with you, and again, it can be a bandana, a scarf. This is a homemade mask that my daughter made. I've seen some masks that are very creative. Somebody had one the other day when I stopped by to pick up some fast food with a big smile. It's a nice way to express yourself. But what we are asking is that if you're out walking in your neighborhood to get some exercise, take your mask with you and put it around your neck, much as I've done right here. Have it ready. Now, if you're walking by yourself, there's no one around, no harm, keep the mask down. If you see somebody coming close to you and 6 feet or closer, then we would ask you simply just to bring the mask back up and cover your face. It's not that difficult. And if you are out jogging, obviously, again, you're not going to probably have it over your face when you're jogging, but if you come in contact with somebody, again, have it around your neck so you can pull it back up. Same thing goes at work. If you're at work, standing or sitting close to someone, cover up. But if you're alone, or if you're alone in your car driving to work, we don't expect you to have your mask on at that time. We know that there's some people that maybe have conditions that do not allow them to have their face covered. We understand that, and that's probably a unique exception. But again, these are rules that are pretty simple. So let me just kind of go through why facial coverings will be required in public settings. And these are examples. If you're waiting in line to go inside a store, you should have your face covered. If you're shopping in a store, again, have your face covered. Same thing with picking up food at a restaurant, waiting for a ride on public transit, riding in a taxi or rideshare vehicle, seeking health care, going into facilities allowed to stay open, or working an essential job that interacts with the public. Now, obviously, there's times when you wouldn't be required to have a face covering. And those might include if you're at home. We don't expect you to have a face covering on all day or all evening at home. That's your choice. You certainly can. If you're in a car alone, or if you're if you're in a car alone or with members of your same household, you don't need to be covered. We don't advocate having facial coverings for children under 2, and that's per guidance from the Center for Disease Control. If individuals are involved in physical activities such as swimming, walking, hiking, running, or bicycling, you don't need to have a facial covering unless you come in contact with somebody within 6 feet. And the last thing I would say is that, again, residents that have a health condition where their doctor does not recommend that they have facial covering, we understand that and we respect that. So I hope this helps a little bit, because I know there's been some confusion. We've got a couple of more days to prepare everyone for the fact that this is going to be the new normal. So we'll keep talking about this to avoid any confusion in the next couple of days. With that, that completes our media briefing for today. We'll see you tomorrow at 2:30. And again, we ask you to stay in place, maintain space, and cover your face. Thank you.